Good morning, everybody. It's Dr. Pearlman. I want to take a couple of seconds to inform you about something that's very important to understand. The less active you are, right? So if you are someone who works a lot and does not prioritize functional, intentional movement, so if you're not doing CrossFit, if you're not going to the gym every day, if you're not moving heavy weights, if you're not contracting your muscles, if you're not doing planks, if you're not doing burpees, if you're not doing yoga, if you're not doing purposeful, like compound, tough movements that will demand strain, so to speak, on your body, or at least fatigue on your body to build up the tolerance to it, when you try to do something a little bit too much or you hold a position a little too long, you could definitely introduce injury. And the reason I'm making that video now today while I switch arms because of fatigue is yesterday I had a nice day off where I finally didn't have to go get chiropractic. I didn't go and get shockwave therapy. I said, today's the day I feel great. I'm just gonna rest. I'm gonna recover. I'm gonna walk. I'm gonna do all my administrative stuff. I'm gonna go back to the office tomorrow. I'm gonna feel great. And that would have been the case, except I washed my own car, which really needed it. And man, does she look great. But the problem is I started having a little bit of pain in my left leg. Now I've had issues with my left leg since surgery. But as the day wore on, what I thought was a little radiculopathy turned into just debilitating pain in my left hamstring, left calf, left knee. And when I realized, as the evening went on, I started to think, I said, did I really just strain, micro tears, strain through like holding a fixed position or being in and out of a position too long while washing the car? And I'll be honest with you, the answer is yes. And I'm gonna get to why in a minute. But the answer is yes, in the sense that I am deconditioned. I'm actually so deconditioned from my surgery 1 year ago that I have not been able to progressively load and progressively move to get back to where I am stable and able to function at the capacity that I was used to before. So when I woke up this morning limping like, somebody that's got a bum leg, I realized what can I do about it? And here's the beauty of it. This is one of the reasons I got shockwave therapy in the office. I've never seen something work so fast, that's so gentle, but yet so effective based on the science, the acoustic waves to the tissue, breaking up adhesions, breaking up scar tissue, but also acting as not just a pain inhibitory effect through the microcavitations, through the gas and fluid exchange in the tissue, but it actually brings neurovascular rejuvenation and rehabilitation to the tissues, such as tendons, menisci, cartilage, and various other things depending on the joint. So I ran it for about 6 minutes total between my hamstring, calf, outer and inner knee joints. We'll just say like kind of the outside fascia of the IT band. The inner pes anserinus is really where like the bursa sac would be, around that area of the knee. And I can tell you right now that I am, before I start treating patients, 60 to 75% better in terms of pain reduction. This was debilitating as of last night and this morning. And it's just incredible that not only does that technology exist, I'm so thankful that I have it now, I'm so thankful that I have access to it anytime I really want it. And the other thing is, it was the person that introduced it to me in Plano, I'm so thankful for. But that's a side note, because without this technology or knowing that it exists, or having somebody who has actual shockwave, you're just not gonna get the same result. But to go back to the beginning of the topic of this video, what you have to remember, and this is the point, is a lot of us really are that deconditioned, and it's okay. Like, it's okay. We have work, we have families, we have kids, we have school, we have continued education, we have all day at the office, we have sitting all day, we have potentially standing and bending and reaching all day. That's worse on the back than it is on the legs, but you have an injury, you have setbacks. As we age, tissues are less and less resilient. I've talked about that many times in my podcast. And what we have to do is put ourselves in the optimal situation and develop these routines that get us so that doesn't happen, because as we age, those setbacks are going to be so much harder to come back from every time. And it's up to you out there to really do the right thing and start to understand this, take ownership of it, and know what to do when these setbacks occur. All right, everybody, feel free to drop anything you want in the comments. As always, until next time, it's Dr. Pearlman.